Okay, let's go.
You know, our ability to connect with people, to trust them, to love them, it all has to start somewhere. But what happens when those first absolutely crucial bonds just don't form? Well, that's when we start talking about attachment disorders. It's a clinical term, sure, but it helps explain a lifetime of challenges. So let's unpack what it really means. Before we just dive headfirst into some dry clinical definition, let's back up for a second. Let's start with a bigger question. What are the actual building blocks of human connection? I mean, where does our ability to trust and to love even come from? As we're about to see, the answer is buried deep in our very first relationships with the people who take care of us. So when those super early bonds get broken or never form right, it can lead to what doctors and therapists call attachment disorders. To really get it, we've got to start with the official definition. Now, I know it might look a little, textbooky at first, but stick with me because all the clues we need are right there inside it. Okay, so here it is, the full definition. Basically, attachment disorders are disorders of mood, behavior, and social relationships that happen because of a failure to form normal attachments in early childhood. Now that's a mouthful, right? But I want you to think of that sentence like a finished puzzle. To really understand the big picture, we've got to take it apart and look at each piece one by one. So to really get our heads around this, we're going to deconstruct it. We're going to ask 3 key questions. First, what are the effects? What does this actually look like in a person? Second, why does it even happen? And third, when is the most critical time for this to develop? Let's kick things off with the what. So the definition actually starts by telling us about the fallout, the what. And we're not talking about some vague ideas here. These are 3 really specific areas where you can see the disruption playing out in someone's life. Here's that first piece of our puzzle. It points right to the stuff you can actually see: disorders of mood, behavior, and social relationships. What that tells you right away is that this isn't a small problem. It's huge. It affects how a person feels on the inside, how they act on the outside, and their ability to connect with pretty much everyone. And you can see how these 3 things, well, they're separate, but they're also completely tangled up with each other. Mood, that's what's going on inside. Behavior is what everyone else sees. And social relationships, well, that's the result of those first 2 things crashing into each other. It's like a domino effect that starts inside and just ripples outward. Okay, so that makes sense, right? But it begs the question, if those are the effects, what's the actual cause? I mean, why do these problems with mood, behavior, and relationships even happen to begin with? And that question, it takes us right from the what to the why. We're digging deeper now, moving past the symptoms to get to the very root of the problem, the source that the definition is pointing us toward. And here it is. This is the absolute core of the whole thing. A failure to form normal attachments. Now, let's be super clear. We're not just talking about a kid being shy or going through a tough phase. No, this is something much deeper. It's a fundamental breakdown in the most basic human process, learning how to trust and connect with another person. So we've got the effect and we've got the cause. But does it matter when this happens? I mean, can this failure to attach happen at any point in your life? Well, the definition is super specific about this, and it gives us the last major piece of our puzzle. And that brings us to the when. And listen, the timing here isn't just some minor detail. It is absolutely essential to the whole diagnosis. There's a specific window of time when these all-important attachments are supposed to form, and it matters a lot. And that critical time frame, it's nailed down in just 3 words: in early childhood. And that's not random. It points to this crucial period of brain development when we are literally building the wiring for trust, for feeling safe, for social bonding. If that gets messed up then, it's not something a person just gets over. It leaves a lasting mark. So when you lay it all out like this, you can see this clear chain of events. It's simple cause and effect. Step 1, a failure to form those key attachments during that super important window of early childhood. And that directly leads to step 2, these long-term problems with mood, behavior, and the ability to have normal, healthy relationships. All right, so we've taken the whole puzzle apart, right? We've looked at the what, the why, and the when. Now let's snap all those pieces back into place and take one more look at that full definition. And suddenly, the definition makes perfect sense, doesn't it? You can see the whole structure now. The what, those disorders of mood, behavior, and relationships. The why, that failure to form attachments. And the when, in early childhood. Every single part locks together to give us a really clear clinical picture. But when you really think about it, this is so much more than just a clinical definition. It's a really powerful statement about how we're wired as human beings. It tells us that our ability to live a connected, healthy life is so deeply tied to what happens in our very first experiences. So the question I want to leave you with is this. Knowing how important these first bonds are, how does that change the way we view the very foundations of a healthy life?